I will present about the introduction and background. In general, people with eating disorder are those who lack self-confidence. There are two types of eating disorder we will be focusing on, which is binge eating disorder and anorexia nervosa. Both disorders have the same purpose, who is to manage the body, and eating disorder is a condition in which a person eats or does not eat in a way that negatively affects the victim's physical and mental health. Binge eating disorder is a cycle when an individual will eat an adult amount of food without stopping. Most people occasionally binge eating, especially during the holiday or holiday celebration. Binge eating disorder is usually planned, and people who buy special party fruit make a moment of any age can develop an eating disorder, but it usually begins in their late teens and of early 20s. Anorexia nervosa is a disorder that cannot be completely prevented. Anorexia nervosa is characterized by inability to maintain minimum body weight, irregular eating habits that avoid the range of gaining breath of weight, and a disorder when appraising weight and body size. It is a life-threatening disorder.
For the eating disorder patients, mental health theory is needed to adopt our psychological and social behaviors. Superous theory that can be treat our foodborne illness. There are cognitive behavior therapy and family-based treatment. There are two main theories that can be treat our eating disorder and anorexia nervosa. There are cognitive behavior therapy (CBT) and family-based treatment. CBT is the most well-known form of treatment for eating disorder to identify thought patterns and beliefs. This may include thought and beliefs to relate the things like food, weight, figure, and appearance. But for family-based treatment (FBT), some young people may benefit from FBT if they want to change according that way. The most well-known form of treatment for adolescents is FBT. Well, FBT is main treatment for adolescent eating disorder, including anorexia nervosa and binge eating disorder. Most people with eating disorder will improve with available theory.
There are three associating factors in eating disorders, namely sexual harassment, genetics, and bullying. The first factor is sexual harassment. So the study found that almost 30% of people with eating problems were sexually harassed as children, according to one research. So these rates are much better among people with BED, binge eating disorder, compared to anorexia nervosa. So it is crucial to know, however, that correlation does not indicate causality. The second factors could be bullying. So as well as eating disorders, bullying has been shown to directly lead to loss of esteem, social isolations, and a bad body image. In fact, up to 65% of persons with eating disorders attribute their condition to bullying. The last factor could be genetics. So genetics might also contribute to eating disorder. So both anorexia nervosa and binge eating disorders are caused by a mix of genetics and environmental factors.
Hello, my name is Vanessa, and I will be presenting about the stigma in ED and its awareness. Mental illness is taboo in Asian culture as compared to the Western part of the world. Many of us in the community refuse to acknowledge the importance of mental health and the dangers of dismissing mental illnesses, which is why awareness is important in today's society. People with EDs would more than likely face their struggles alone to avoid being ostracized by their peers. EDs are a cry for help and is not a trend for people to follow. Many would believe that patients with EDs are responsible for their condition, and that is purely for the sake of vanity, which is not true at all. Such harmful assumption discourages people with EDs from seeking professional medical help. It is a debilitating disorder that can easily be cured or prevented if we educate the public. For both anorexia nervosa and binge eating disorder, people who suffer from these disorders would isolate themselves from the world to avoid being shamed. With this, social withdrawal would worsen their symptoms, and they could develop more serious issues if not diagnosed and taken care of. Despite the progressiveness of mental health treatments over the last 50 years, there is still a significant number of people who refuse to seek professional medical help in Malaysia. The stigma associated with ED diagnosis may cause people to be labeled by their disorder, which leads to internalized stigma experienced from negative views held by others. According to a recent study by Chua et al. In 2022, which is the first study to use a diagnostic screen to estimate the prevalence of EDs in a population-based sample of Malaysians, over 50% of the recipients reported symptoms of EDs. Therefore, educating the public of the dangers of EDs plays an important role in the government side.
As for anorexia nervosa, people with AN have different way of perceiving their bodies. Patients with AN display an extreme fear of gaining weight while being underweight. So anorexia is one of disorders that can lead to anxiety. In a research, AN patient would have brittle nails and hair, increased thirst and urination, a swelling joint, constipation, and irregular menstruations for female patients due to malnutrition. So the next one was binge eating disorders. Individuals with BED often consume large quantity of food quickly, even when they are not hungry. Such eating pattern would lead to further diet-related health problems like high cholesterol, diabetes, high blood pressure, and heart disease. So people with BED also experience sleep problems and irritable bowel syndromes. So women with BED might develop fertility problems and polycystic ovary syndrome.
For coping strategies in an attempt to ease the burdens of EDs among patients, it is important to note that it is not an easy journey. A good support system is necessary to ensure recovery, and even then, the patient's support system must be attentive to their needs in order to avoid relapsing. Support must be given constantly to encourage growth and treatment. Patients must be cared for without any judgment, and that is why caregivers have the most important role in the aid of recovery. These EDs are perceived as uncontrollable and spontaneous, that is grueling to manage and track, thus emphasizing the difficulties of determining how it happens in the first place. By making sure at least one person, preferably a friend or a family member, is aware of a patient's ED struggles, they can help with managing food intake as well as being a motivator. A support group recommended by a medical professional is also a good coping strategy. ED patients can share their stories and struggles with people alike to make sure they do not feel alone in this world. Additionally, therapy and counseling sessions are encouraged for people with EDs or anyone struggling in their daily lives. Nutrition also needs to be regular to cope with the recovery to ensure that the body gets enough daily food intake.
In conclusion, both Anorexia, Nervosa, and Binge eating disorder is felt if this issue not taken seriously. It is great important to educate ourselves and the people around us about the eating disorder. This issue continues to be a concern to the general public, where there is a possibility that many people are undiagnosed if the government promote to the public about this mental illness. Even though eating disorder are mental disorder that cannot be seen, but everyone must treat it as the same way as physical injuries. And getting help is the first step to recovery. As our study found, eating disorder found at every age and which without the knowledge of diagnosis. Therefore, each person could benefit from the government initiative on lowering the risk of developing the eating disorder among Malaysians. Only when the public made aware of the dangers of the eating disorder, more people will be cautious and get them checked out by the psychiatrist. Therefore, more other research can be done to identify the vulnerable individuals who are easily influenced to follow the trends of the body objectification and image.